Old age obesity. The old people, like which genetic group has more obesity? People think that people have the deposition of fat for because and longer standing overeating. Yeah, it is true, but it's not the always case. In old age, why it happens? In old age, you have the celopathies. Is more common. Celopathy means the hypothalamic sensory neuronal cilia that sends leptin and melanocortin level in the serum, and thereby when someone eats, when stomach is full, it gets the negative. It gives the negative impulse. Yeah, it says, yeah, I'm full, so don't eat anymore. So there is satiety. But when this doesn't happen because of the old age, your ciliary dysfunction, ciliopathies, and this cilia, they've been normal, but afterwards, because of the old age, the degenerative change and the inflammation, because the non-communicable disease, it is basically a low-grade inflammation throughout the body in all the systems. So thereby, it can have the adult old people, like the genetic group, can have the disturbance in the ciliary response. So thereby, this ciliopathies can cause the overeating and obesity. They have apart from that, they have the higher energy, less energy expenditures, and brown fat thermogenesis. They have increased adipogenesis. So thereby obese people have in adult age. It's common, and they should recognize this pattern. Compensatory under eating and balance eating, dietary consultation is good for them. Apart from that, other pseudopathies human being are the retinal dystrophy in kidney, the PKD, polycystic kidney disease, adult onset, pediatric onset, and then you have your laterality, Cartagena syndrome, dextrocardia, hearing loss possible, anosmia, the cilia in the defective, and in the nose defective, and liver you can have hepatic fibrosis. The polycystic kidney, they have hepatic fibrosis. Infertility is common in the ciliopathy, and plenty of other syndromes like Bardet-Biedl and Alstrom, Carpenter, and Norm syndrome. They have the ciliopathy. Their children's obese. They have other syndromic presentations and features. So it is to be recognized in the larger group of people, mostly geriatric people, in the obese people. And obesity is a bad thing. The non-communicable disease, heart, lung, and your kidney, brain, stroke, and then liver failure, cirrhosis. They are more common. Thereby, they should recognize this part and should eat less compensatory to avoid the bad consequences of obesity.